Welcome to this instructional video on how to mobilize a patient to the edge of the bed in an ICU setting. I'm Shay, and I'm a physical therapy student, and today we're going to be working through how to mobilize a patient with common lines, drains, and tubes found in this setting. Whether you're a healthcare provider or a student, it's important how to mobilize patients and manage these devices in order to maintain safety and comfort. Before you start, it's essential to perform a thorough assessment of the patient's condition and the medical devices that they have in place. Common lines, drains, and tubes in the ICU include A lines for blood pressure monitoring, Foley catheters for urine drainage, PICC, PIC, or CVC lines for intravenous access, ventilators for breathing support, and various monitoring devices like oximetry, blood pressure cuffs, and heart rate monitors. Prior to mobilization, check the placement of each device and ensure that they are secure and that none will be inadvertently pulled or displaced when moving the patient. After identifying all the lines, drains, and tubes, now move on to setting up the room for safe and efficient mobilization. Start by ensuring that all the cables and tubes are untangled and have enough slack for movement. You don't want to pull on any of the lines or create tension that could disrupt vital equipment. Next, you'll want to position the patient properly before assisting them to sit up. Make sure you're aware of the patient's current level of alertness and ability to follow commands. If the patient is sedated or intubated, additional assistance may be required. Now let's begin moving the patient to the edge of the bed. I'm going to use a technique where we first roll the patient toward me, allowing them to use their arms and legs for support. During bed mobility, be cautious not to put pressure on any of the lines or tubes, or it may disrupt its placement and the reading. Once the patient is in a sitting position, check their vital signs closely. If they're on a ventilator, monitor the oxygen levels and make sure the respiratory rate remains stable. Keep an eye on their blood pressure as well, as the change in position can sometimes cause hypotension. If needed, assist them in adjusting their position to stay comfortable and maintain stability. Once the patient is comfortably sitting at the edge of the bed, make sure all the equipment is properly secured and that the patient is stable. If the patient is able to participate in their care, encourage them to engage in deep breathing exercises or help with repositioning themselves if appropriate. When returning the patient back to bed, it is critical that you make sure that all of the devices are secure, just as you did as getting them up to the edge of the bed. Double check that any lines, drains, or tubing are not under tension and that the collection bags, like the Foley bag, are positioned lower than the bladder to prevent backflow. Once the patient is safely back in bed, it's time to reconnect and adjust any lines and equipment that may have become disconnected or shifted during the move. Be sure that the patient is well supported in bed with pillows or cushions as needed for comfort. Adjust the head of the bed if necessary, and always check for any possible signs of pressure injury or discomfort. And that's how you safely assist a patient to sit at the edge of the bed in the ICU setting, managing common lines, drains, and tubes. It's about ensuring patient safety, maintaining the integrity of medical devices, and ensuring comfortability during the mobilization process. Thanks for watching, and have a wonderful clinical experience.